Hello, I'm Dr. Preethi Mrinalini, General Laparoscopic and a Bariatric surgeon practicing in Bevel Hospitals, Chennai. So today's topic of discussion is hemorrhoids, or in other words, piles. This is a very common complaint from many people, especially during the summer season. So what is piles? What is hemorrhoids? These hemorrhoids are basically just hemorrhoidal veins that are bulged out in due course of time due to various risk factors, which I will get back later during the talk. So because of various risk factors, these hemorrhoidal veins bulge, and slowly what happens is they start descending down inside the rectal tract, which causes like one sort of bulge that is felt, which is very troublesome, sometimes painful, and sometimes there is bleeding also associated while passing stools. This is not something to be ashamed of, okay? It is a very common complaint and you can approach your general surgeon for your guidance. So to give you more gist about what is piles and the grades of piles, so there are internal and external hemorrhoids. So there is something called the dentate line, above which is all the rectal or the endodermal tissue that is found, and below that is skin. So the ones that are external, so external hemorrhoids generally cause more pain, right? So but the internal hemorrhoids can also be very troublesome once they descend down. So grade 1 would just be a bulge that is there inside, might not cause too much trouble. Grade 2 is something that descends a little down, but it will be able to go back inside. Grade 3 is something that comes all the way out and needs to be pushed inside, whereas grade 4 is almost always outside and is very, very troublesome. Now let's talk about the risk factors of developing hemorrhoids or piles. So the first thing that we have to note is it can occur in anyone, from youngsters to adults, right? So now the main risk factor is constipation due to various factors. Few people have very bad eating habits, okay, and they drink very less amount of water, which can definitely lead into constipation. Okay, so now because of constipation, a person spends more time sitting in the loo, right? So that causes increased abdominal pressure, which might lead to dilatation of the hemorrhoidal veins, therefore leading into hemorrhoids or piles. So now apart from constipation, what else can cause piles? Some sort of exercise like heavy lifting, people who work out too much in the gym, and that can lead to a lot of increased abdominal pressure, which can again cause hemorrhoids or piles. All right. So these are the main risk factors for developing hemorrhoids. And the third risk factor for developing hemorrhoids or piles would be pregnancies. Pregnancy, again, see, the physiology is the same. It's all about increased intra-abdominal pressure, which definitely pregnancy has. So invariably, pregnant mothers tend to develop hemorrhoids or piles. Now let's dive into the treatment options or how to manage piles. Now say you feel some sort of uncomfortable feeling while passing stools, all right? So you first need to find out if definitely this is piles or you have some other issue for which you require a per-rectal examination, which will be done by your general surgeon. Right? So once we have established that you are diagnosed with hemorrhoids, the next treatment is we can either do a conservative or a medical management or directly go into surgery. Now, when do we do a conservative management? Conservative management is done in grade 1 and 2 hemorrhoids. The reason why we can do a conservative management for grade 1 and 2 is that it's a smaller grade, and also over there we notice that the hemorrhoids or the hemorrhoidal vein is not progressed down, right? And it can subside with medical or conservative management itself. So what we do there is we ask you to do regular sitz bath Sitz bath is nothing but you take a warm luke water, okay, and you sit in it for like 10 minutes in the morning and night, which will help warm the bulged out veins and which will help subsiding the hemorrhoids from progressing further, and it will also aid with your symptoms. Now apart from that, we will also give you some creams which will help again, and also ask you to be on a very high fiber diet and also drink plenty of water. So now this is the conservative management. Now few grades of hemorrhoids, even though they are smaller, they do not respond to conservative management. So initially we will try conservative, but irrespective, if your symptoms are not relieved or if the condition is worsening, then we go into surgical management. But for grade 3 and grade 4 hemorrhoids, it is directly choosing surgery over conservative management. And when it comes to surgical management, we will do a hemorrhoidectomy. There are different types of hemorrhoidectomy, like just using the knife to cut it out, or a stapler or rubber band ligation. There are various options and you should approach your general surgeon. So if you have any queries or questions, do not hesitate to ask. You can drop it at the comments below and we will get back to you at the earliest. All is well with Be Well. Thank you.